Hey, thank you so much for joining us. We all know that a pandemic is also a communication emergency, and that this pandemic has revealed more or less a total breakdown of communication in the United States. And we want to have a discussion here about how to combat health misinformation in the internet age, where we really use COVID-19 as the lens through which to examine the causes and fallout of health misinformation. We know that this is so deeply important because we need people to do certain things. And in order for them to do certain things, they need certain information and they need to trust expert advice on how they can protect themselves and their communities. We, in my role at the Atlantic, ended up founding something called the COVID Tracking Project at the Atlantic, where we compile information from states and we put it out into the world. And so we're actually really deeply immersed in the information ecosystem right now, particularly on Twitter, but we see where our information shows up around the internet. And firsthand, we see how bad that ecosystem really is. I mean, we think about all the reply guys who are always, trying to minimize what's happening with this disease, who kind of swarm to particular data points and try to convince people that the pandemic, isn't that big of a deal, doesn't kill that many people, is not dangerous to young people at all. And there's a variety of things that we've sort of watched through time as the pandemic has gone through these various stages. And my question for the two of you is what we know about that world, this internet world, of a bunch of people who are bad faith actors, as far as I'm concerned, and what people actually do in their lives. And I'd love to just know, do those people actually change minds, and do they get people to engage in different types of behavior? We can start either place.
Sure. Who wants to kick off?
Go ahead.
Dr. Wardle, you want to go? You can. Yeah.
Well, I was just going to say, I mean, part of the problem we have here is that we have very little research about this. And so people want to say, does fact-checking work? Do the bad actors influence things? And we kind of want this catch-all. And the truth is we don't have good data on this. But we're seeing right now, as we see the eyewitness videos of people spitting at each other in grocery stores and fighting around masks. I mean, we have a real-time moment of recognizing behavioral beliefs that we have to think about. What are all the different elements that are playing into that? And partly that's what people are seeing online, but that's also how it's intersecting with interpersonal communications and the groups that they spend time with. So it's really difficult to unpack, but there's something very serious going on, that's for sure.
Right. The way I look at it, this is like the proverbial pony and the horse manure story, so forgive me for that kind of analogy. There's no question that there is a lot of attention or information towards disinformation and misinformation. Those of us who are in this world, all of us on this group, pay a lot of attention to it, and the media pay attention to it. And then we have these viral videos, as Dr. Wardle said, that show up. Every little incident and anecdote gets magnified. And social media, in an effect, lead to that kind of a spiral of amplification, where even simple incident or quote or a conspiracy from a corner gets spiraled and amplified, and somehow it gives us an impression that everybody's being affected by this, right? So the question then is, as Dr. Wardle said, what are the data showing? If that were true, that everybody should be affected by these conspiracies, and we know how bad it is, in the ecosystem, as you rightly said, everyone should not be wearing masks. People should be spitting at each other. They should be lighting up cell phone towers left and right. But that's not what's happening, right? What are the data showing? The data are clearly showing that 60 to 70% of the people are wearing masks. 60 to 70% of the people are saying masks should be worn most of the time, and if not all of the time. And many people are very supportive of being compliant with public health recommendations, right? So people are smarter than we give them credit for. And that's fortunate in many ways that they're not being as affected as we think they are. Now, the problem is, it doesn't require all 100% to disagree, right? It requires only a very small percentage to disagree, not be compliant, and cause problems. And that's what you are seeing here. Even if it's only 20 to 30%, depending upon how you ask the question, that's enough to cause a problem. The last point I want to say is, unfortunately, it is reciprocated, echoed, and amplified by some in authority. As a result of it, there is a definite undermining of public health authority, I think. So that's the problem we are seeing here.
Yeah, and that's what I wanted to ask, what do we know about that 20 or 30%? I will say from observation of the people we know and who attack our project, that it's really overwhelmingly within the conservative base that this is really happening. And it feels like we have to be able to name that in order to be able to get at some of the dynamics of why this is happening. Is that an accurate perception from my sort of like anecdata of having engaged with thousands of people on Twitter?
So the current data we have are from the Pew Center's polling, right? And the data are very interesting, right? So ideology apparently trumps everything else. Pardon for that phraseology. So if you divide the population who have been surveyed, the sample who have been surveyed, and look at them Republican leaning versus Democrat and Democratic leaning, you clearly are seeing the differences. The people who are unlikely are less likely to support masks, are less likely to support other active drug public health measures, are certainly of a certain political bent of mind. And that's what the data are very clearly showing the differences. In fact, even norms data, whether I will get support if I wear a face mask, also varies depending upon your political ideology. So those data are available in the US. In the other countries, it's a little difficult, but certainly anecdotes, a collection of anecdotes do not make evidence, but certainly what's happening in Serbia and other places show that, again, certain types of political mentality or mindsets or ideologies seem to be driving people to be less compliant and questioning these things.
Dr. Wardle, I want to come to you because, in my time as a journalist writing about, science, technology, health, last 13 years, I actually oftentimes associated health misinformation specifically with a certain kind of liberal worldview, actually, particularly the kind of, I live in California, so no shade on California, but kind of like the California anti-vaxxer, who just decides that pharmaceutical companies are a certain way and, the health system is a certain way. And so therefore they're just not going to get vaccinated. In the broader health misinformation sphere, what do we know about how people's political leanings drive their consumption of health information and subsequent behavior?
Yeah, I was just going to say, there's a great book called Networked Propaganda by Yoko Bankler and colleagues from Harvard that talks very much about political disinformation. And certainly it's definitely not a level playing field, and it's disproportionately on the right. But to your point about health misinformation, it's the traditional croissant. You see people from the far right talking about medical freedom, and you see the far left, which is very much about, I'm not going to put anything into my body that I don't know where it's come from. And so then you've got two very different wings there, but as worried about the vaccine, and as we think about anti-vax movements that have existed for the last 10 years, and then say, well, how is that going to work in the age of the COVID vaccine? And that's what everybody is now really, really concerned about, which is we haven't necessarily taken these anti-vaccine movements seriously. And I think whilst I absolutely agree, which is we need better data, and certainly there are, 70% of the population is following things. The pandemic video was a moment where I suddenly saw the kind of belief that, we monitor this stuff every day and you see it all the time, but it's in the fringes. And I often, would say to my team, this is not something to write a briefing about or to alert anybody about. It's the usual stuff. But in the last 2 months or 2 to 3 months, what we've seen is a lot of this conspiracy content move much more into the mainstream. And we have to understand why. It's because in this moment, most people's lives are being turned upside down. and they don't have explanations. We don't have a clear origin story of the virus. We don't have, even the WHO is still trying to decide whether or not this is airborne. We don't have a clear spreading story. We don't have a clear treatment, although things are looking much better. But in that absence of explanation, people are looking for self-efficacy, and sharing a really highly produced video that gives an explanation and tells you why you're all being duped, that gives people this sense of like, oh. And so if we don't grapple with the why people are susceptible and why, yes, there's ideology, but right now all of us are freaking out.
Yeah.
Doesn't matter how educated you are, where you live, or, you know, and I think we've really got to grapple with that emotional response to information that we have failed to do as communities of fact checkers, researchers, and journalists.
It also seems like this particular virus and the disease it causes were so ripe for creating misinformation possibilities because we did know very much about it to begin with. And I want to ask what I think is a somewhat difficult question that I've asked myself over time. You know, public health officials in January, February, and into March, you know, the one people always mention is the mask advice changing, right? But it seemed to me that throughout January, February, and into March, public health officials took a quite tactical approach to their communications with the public. So the approach was, well, don't wear a mask because we don't want you to go hoard and buy all these masks. As opposed to saying, masks may very well work, and you could wear one, but don't go buy them. And it was like they were trying to get one step ahead of the public. And in some cases, you know, I've gone back and listened to CDC briefings in February. They went out of their way to say that masks were going to be ineffective because people are going to be touching their faces and all these other things. And so given that public health officials do have to change their messaging in response to new scientific understanding and new sort of on the ground logistical realities, how should they handle that so that those things can't then later be weaponized into, you know, these misinformation campaigns?
That's interesting. So, you know, this morning I watched a video, which is clearly a disinformation video on WhatsApp, right? It's a different kind of a platform where they're actually splicing what WHO said in January with what is being said today. Very, very conservative news organization today as if WHO is being irresponsible. So you see this all the time. So science always changes its recommendations. We know that, you know, but the problem is it's happening in such a compressed timeline now. I think that has been the problem. That's why when we said in January and February, don't wear masks, and as the science changed, you know, now we have to backtrack and say, no, we now recommend that you wear masks, I think. And I think it is a problem. I think we did get, again, you know, as Dr. Fauci was saying and others were saying, if we have a crystal ball, we made a few mistakes in the way we were communicating. I think one of them was about being so certain in our recommendations. If you go back and look at what we did with H1N1, we were never this certain with our recommendations. We were always clear about what we knew and what we did not know, as opposed to this time where we were very definitive about our recommendations. I think the second issue, I think here, in the way we did this is, you know, example is, you know, only older people are affected by it. As if that means by implication, younger people and other people are not affected by it. And now we are paying the price for that. I think if we were to redo it all over again, and there are never redos like this in life, you know, I think certainly we could have been much more careful in the way we messaged right from the beginning, and we were not. I think, you know, preparedness, the very definition of public health emergency preparedness is exactly this. We focus a lot more attention on epidemiological aspects of it, but not certainly on the informational aspects of it and how to prepare for these kinds of pandemics.
And we're just terrible explaining how science works. So those of us who come from an academic setting understand that when somebody says there's not enough evidence to prove, we all go, oh yeah, okay. But that doesn't necessarily make sense for everybody else. So when WHO said there isn't enough evidence to, that in the land that we live in now in terms of information disorder gets taken as, well, you know, they're changing their minds on things. So I think as we prepare for the inevitable next pandemic, the question is, how can we actually teach people how the sausage is made and be much, much better at explaining this is what science looks like. And this is what science looks like when a virus appears that we know absolutely nothing about it beforehand. And I think we failed to think about crisis communications. And I absolutely agree. We made a ton of mistakes and I hope we learn from them because unfortunately there isn't the space to make mistakes there never was a good time to make mistakes, but in an age that we live in now, there is no room for maneuver, and any correctional retraction, as we know, goes nowhere near the same direction and speed that the original.
Right. You know, we've got a question from Nancy Van Arsdale about the variability of university plan reopenings. And I think you could say the same thing about school plan reopenings. And the informational question here, I think, is how much people interpret the sort of openness or closedness as a signal of sort of how the outbreak is going. Like, this is something that I've been so curious about, is whether sending the message of kids going back to school, even if that were safe for children, might actually have these other sort of consequences of people sort of thinking life was going back to normal when it's not. And so the kind of final question I have for you is, what do we know about how people weigh real world behavioral things with the information that they're sort of receiving? So if they're receiving information, you know, like this pandemic is going terribly, but oh, hey, my school's open and my university's open. Like, what do we know about how people weight those different things?
People are terrible at probabilities, right? So they don't calculate, they can't calculate. Even I'm terrible at it. I'm supposed to be a scientist, right? That's not how we think. We think in two ways, right? One is what our people around us, our significant others, our friends, our colleagues, our families are saying about this. And of course, media do matter. I think in this case, you know, especially political authorities. And I think this is what is confusing people. I think, you know, unlike any other pandemic, right, we are affected in every sector of our lives, every aspect of our life, right, unlike in previous pandemics. So parents are anxious for children whose education has been interrupted to send their children back to school. Particularly, we never talked about communication disparities here for certain parents who don't have access to these kinds of digital health services, digital inequalities, you know, our communication inequalities. They are affected by this, and they do want to send their children to school. At the same time, and there is that feeling, well, if you're sending children to school, are we opening up, you know? And so people, I think, are having difficulty weighing in those probabilities. If it happens, X is likely to happen, and Y is likely to happen. And I think that's what is leading to this tremendous confusion. And then the stakeholders, right? There are teachers, there are parents, there are politicians, you know, who are all weighing in. I think, you know, that's what is causing so much stress and anxiety all around these notions of reopening, whether it is schools or colleges or economy in general.
Right. Dr. Wardle, you want the last word?
Well, no, just to agree that we're all terrible at risk. And I'd say even those of us who spend all day doom scrolling on Twitter, I'm really confused. And so I think that to that point, that without clear messaging, not only is it leading, those information vacuums and confusion are leading to the misinformation, but people are having to make real world decisions about their own safety and those of the people that they love. And so the absence of clear messaging is not only causing real stress, but just the next few months are looking pretty bleak.
Yeah, and for me at least, I just wish we had the CDC of yesteryear to be holding briefings every day, providing real, accurate scientific information every single day, which is what they did in times past and have not been allowed to do this time. And we will have to leave it there. Thank you to you both so much for joining us, and I'll turn it back to the showrunners.